Welcome to the series, Vitamins for Whole Health. Short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about vitamin A. What is vitamin A? It is a fat-soluble molecule known as retinol, found in food. Fat-soluble means it mixes easily in fats rather than in water. We'll come back to the importance of this later. Retinol can be obtained in the diet as is, but our bodies also possess the ability to take some kinds, not all kinds, of carotenoids and convert them into retinol. You may have heard of beta-carotene. That's the most famous of the carotenoids, and it's how carrots got the reputation for being healthy for your eyes. The eye connection with vitamin A is due to the presence of vitamin A in the back of your retinas. In fact, besides your liver, the greatest concentration of vitamin A in your body is in your retinas, where it participates in a chemical reaction created by light photons that signals your optic nerve how to communicate what you are seeing to your brain. But that's not vitamin A's only job. It also helps communicate to cells what their role is, and what compounds to produce, and how fast to produce them. For example, eyes make tears. Skin stays soft and smooth. Respiratory tract grows those little hairs called cilia that helps keep dust from sticking to the sides of it. Immune system, attack invaders. In this way, vitamin A also helps protect our bodies against diseases that happen when cells forget how they're supposed to act. Additionally, vitamin A is important for the production of your hormones. Did you know that without vitamin A, a teenage boy will not go through puberty? Without adequate vitamin A, you might experience the following. Night blindness, called nyctalopia, as your body rations the vitamin A needed for sight to the daytime only and abandons sensitive nighttime seeing. Dry skin or hair, as your body stops lubricating your tissues. Severe dryness of the eyes, called xerophthalmia, which can progress to complete blindness if not treated with vitamin A. Weston A. Price, a dentist and world traveler who wrote about the diets of indigenous societies about a century ago, told of a prospector on the frontier who developed xerophthalmia from vitamin A deficiency. The man could hardly navigate alone in the wilderness from onsetting blindness, until a passing Native American man took him by the hand, led him to a river, and fed him the eyes and eye-adjacent tissues of a freshwater fish. In the following days, the prospector recovered most of his sight from the vitamin A in that meal. Now, the recommended daily allowance, or RDA, for men is 900 micrograms per day. The recommended daily allowance, again, RDA, for women is 700 micrograms per day. You can consume more, but too much has its own problems, as we will see shortly. Some sources of vitamin A. You'll note there on the left your animal sources, such as liver, milk, butter, and eggs. And of course, the animals are getting this vitamin A from the beta-carotene in their own diets, which they turn into retinol within their own bodies and put into these sources. In terms of plant sources, again, keeping in mind, you will not get retinol from plant sources, but you can obtain it through the conversion of the beta-carotene in those plants within your own body. Plant sources include carrots, peppers, green leafy vegetables, and sweet potatoes as some of the highest sources. Not an exhaustive list. There are some obstacles to getting vitamin A from plant sources, of course, as I've inferred. Among other things, fiber inhibits the absorption of vitamin A as beta-carotene. Now, inflammation can reduce beta-carotene to retinol conversion within our own bodies. This means this conversion is not as efficient, which means we're not getting as much retinol in the final equation, even though we're turning orange from the carrots we eat. Nutrient deficiencies like iron, zinc, and protein can inhibit this conversion as well. Some conditions like diabetes and hypothyroidism can also inhibit this conversion. And of course, no matter what your health status, your genetics play a big role in how well you make this conversion. So who is at risk for vitamin A deficiency? Number one, vegans, because of course they're not consuming retinol finished vitamin A, preformed vitamin A in the diet. Of course, number 2 is low-fat dieters because as a fat-soluble vitamin, without adequate fat for absorption, that vitamin has a hard time, even as beta-carotene, getting across the intestines and into circulation for use by your body. And of course, we all know some children who are picky eaters. I was one, my son is one, you probably know a few in your life. So, how do we boost vitamin A? Well, the easiest way is to eat animal sources of vitamin A, again, retinol, preformed vitamin A, several times per week. But even failing that, you can eat vitamin A or beta carotene containing foods with a fat or oil containing meal to uptake more into your system. For vegetables, you can, of course, cook and or puree them to release more carotenoids from the cell walls within that plant that you are consuming, and therefore more will be available for conversion within your own tissues. And as mentioned, being nutritionally adequate in vitamin E, zinc, and iron will also help optimize that conversion. As I mentioned, there is the risk of vitamin A toxicity. You can't have too much of a good thing. This can weaken bones, even in minor toxicity. It can cause birth defects in the first 8 weeks of pregnancy when a pregnant woman is consuming too much. There's all kinds of other symptoms of toxicity. You can look these up on the internet, but just a few: fatigue, hair loss, headache, cracked lips, upset stomach, and dry or peeling skin can all indicate vitamin A toxicity. But of course, they can indicate other health conditions as well. So do your research and speak to your doctor if you are concerned about a vitamin A toxicity. The tolerable upper intake level for adults is 10,000 IUs, that is 3,000 micrograms. So again, a long way north of that 900 for men, 700 for women micrograms per day. You do need to be consuming quite a lot of vitamin A to hit, or supplementing, to hit that toxicity threshold. Again, humans can handle about 10,000 IUs of retinol at a time per day on a consistent basis. It does take a while to build up as well. But there are stories of explorers getting pretty rapid onset of vitamin A toxicity. How? Well, from eating liver, and not just any liver. These are explorers in the Arctic eating polar bear liver, which contains over 1 million IU of vitamin A, that is preformed finished retinol, per pound of polar bear liver. Thank you for viewing the vitamin A installment of Vitamins for Whole Health. We'll see you around.